So welcome to another episode of On Call with Dr. Randy. I have one of my good friends here, Dr. Oluchi. We've known each other probably, what is this, 2020, this 15, 16 years now?
Yes, long
Yes,
time.
yes. It's making me seem old now when I say it out loud. Yes, so we did a summer program together back in 2004 at Duke University when we were both kind of pursuing our initial medical careers. And so we've both come full circle and to become doctors.
Yes, can't believe it.
Yes. Just a little insight. So meeting Oluchi, this was my first time meeting a light-skinned person from Africa. I was so,
What?
yes, you and our other friend Queen. I was
Yes.
like, man, they have light-skinned people in Africa too. I can only go by what I had seen on TV. So that was my country self being exposed to other individuals and not being so stereotypical with the things that I've seen before in life. So that program enlightened me to other things that I'm thankful for in my adulthood that was kind of stupid as a youth.
That's funny, Randy.
Right. So Dr. Oluchi is an internal medicine physician. So what made you want to be a doctor growing up?
Oh, well, I grew up around medicine. My mom is a family medicine physician.
Okay.
She actually became a physician in Nigeria before my family moved here. And then when she moved here, they actually didn't recognize her training, so she had to redo residency, which now that I've gone through residency, looking back, I'm like, how in the world did you do that? So I've always been around medicine. She actually opened her own private practice and practiced for almost 30 years, solo private practice. She was there 7 days a week and worked very, very hard. Yeah, most weeks. So that actually made me not want to go into medicine. But
7 days a week. Wow.
I know. She worked really, really hard. She loved her patients and really just did so much for the community. So that part, put something in me like, wow, it's really cool that you can do this and you can reach so many people. But the stress and seeing the other side of it, I was like, I don't know if this is for me. But what actually made me interested in it as a career for me is I remember in 4th grade, I was doing this science project or something. And, back in those days, there was no internet, telling how old we are. But I had to go and look up in an encyclopedia or something about, well, she said, look up a health condition or something that you're interested in. So my mom was like, oh, why don't you look up the silent killer? And I'm like, what is the silent killer? So I went and looked it up and I was like, oh my goodness, people are walking around with high blood pressure, just like a ticking time bomb, like I talked about in one of my videos, and they have no idea and it's killing people. And like my eyes were just open at that moment. I was like, this is like, we got to do something.
You thought about that in 4th grade. You started looking at people different, like,
I
Mom,
sure was.
Mom, is he dying?
Your blood pressure? I'm like asking random people if they know. Because I was really disturbed. I'm like, you mean somebody could just pass out and die because they have this high blood pressure and they don't know about it? So anyway, so that kind of stayed in my mind as I got older and went on through high school and college. And during college is when I started doing different programs, like the one that we met at. And I wanted to really expose myself to see if medicine was for me or if I just, wanted to do something in, let's say, preventive health, because that was the other thing I was considering. I was like, I know I want to help people not get these preventable diseases, but I don't know if I necessarily need to become a doctor or if I can do that through a different avenue. So really doing those programs kind of opened my eyes. And I just realized that while I could do something like public health, I think I would just make a bigger impact if I could talk to people one-on-one. And that's why I was driven towards medicine, so that I could have those one-on-one interactions with patients and really kind of inspire them to take control of their health so that they don't develop these preventable diseases. So I've been talking about preventable diseases, Randy, since I was in elementary school, literally.
Since you were looking up stuff in encyclopedia. Right. Somebody's listening to this right now. They're going to have to Google what is an encyclopedia.
I know.
I remember I used to have like a whole set in my house, 20 books in there.
Yeah.
Look it up in the index. Then okay, it's in book number 8. Like, all right, that page. Yeah.
Exactly. Was it like Britannica or something crazy like that?
Right. And the funny thing is that we think we had it bad. If you were to ask your mom how
Yeah,
bad she may have had it and what she had to do to go look up stuff, like go to
for
the library
real.
or
For real.
the Dewey Decimal System and all kind of
I
stuff.
know.
How,
We've come
how
a long way.
how many brothers and sisters do you have?
I have two brothers. I'm
Okay,
the middle
okay.
child.
All right. So what was it like growing up in a household like that with your mom being a physician working 7 days a week?
It was I would say pretty busy. Like
Mhm.
we were all involved in so many different things. We all played instruments. We had like a very regimented family. We all played instruments. We all played sports. We all were doing different educational programs at schools and summers. Like every single summer, we did educational programs while
Mhm.
people were like getting to relax and stuff. We were doing ACT prep and all this stuff. So it was, I mean, it was very interesting. It was fun, looking back now, those days, I'm just like, can I just get a moment to chill? But
And I go outside and play. Right?
oh yeah, oh no, we played a lot because
Okay.
we weren't allowed to watch TV during the week. We only had to
Okay.
watch TV Friday, Saturday, and Sunday. Friday night, Saturday, and Sunday. So
Okay.
we spent a lot of time outside, actually.
You remember what was your go-to show that you was looking forward to on the weekends? Was it
Oh
Family
yeah,
Matters or something?
exactly. TGIF. I lived for that.
There we go. Boy Meets World, all of that stuff
Yes.
right there
Family
on a
Matters was
Friday.
my favorite.
What instrument did you play?
I play the violin.
Okay. You still play it or it's in the
No,
closet
I
collecting
haven't played
dust?
in years. I'm the black sheep in the family from that sense. Is
Okay.
my older brothers, they played all through. They still play piano, saxophone, all of that. My parents both play instruments. I'm like the only one who's my violin is sitting on the counter somewhere, sadly.
Okay. The Dr. Black Sheep of the family.
I know.
Hmm. So what made you go into internal medicine?
Well, back to the wellness part of it, I really wanted to find out how I can reach the most people to prevent illnesses. And I just figured primary care, catching them at the beginning before things happen would be the best way. I considered things like surgery, but I'm like, well, they're already kind of coming for an issue that needs to be taken care of right then and there. It's like not enough time to start really counseling them and trying to help them prevent whatever that was.
Hmm.
So I just figured internal medicine would give me the best chance to catch them early.
Right, right. Has it been everything you thought it would be?
In a way it has, but in a way it hasn't. So let
Hmm.
me start with how it hasn't. So when I went into medicine, I was expecting just the chance to really educate people and just inspire them and really help them meet their goals.
Hmm.
So I became disillusioned even in residency because I to get into a routine that can really help their health. But then, someone's knocking on my door, like your next patient is waiting. So there was not enough time built into the normal everyday primary care life to really help and push my patients the way that I wanted to. So I didn't like that aspect of it. Now, the reason I say that it has been what I wanted to be is because I really just made it my own. When I
Hmm.
got out of residency, instead of kind of going to work at a traditional primary care practice, I went to work at a wellness clinic where all we did was focus on helping people stay healthy. And it was the best experience ever. Now, it was an executive wellness clinic, so we kind of focused on, we only really got to see kind of the executives of companies and like these,
Hmm.
people way up there. So it wasn't really the population that I wanted to see
Hmm.
completely, but I learned a lot from that because I had the time to really sit there and counsel them and help them get the resources. And these people did better for the most part because we got to sit there and make a plan. But
Hmm.
even then, they were only coming in once a year. So it was hard we'd come up with this great plan, they'd be motivated. And then by the time they come in, it's still like, oh, doctor, I did it for a few months and then I kind of fell off. So
Hmm.
that's where I started realizing that, every once a year still isn't enough if people really want to make these changes.
Right,
So
right.
I've made it and that's why I ended up starting my own wellness company because I
Mhm.
wanted to do more of the interaction with people and kind of walk them through the journey.
Right. Okay. So while we on that, tell me a little bit about your wellness boutique company. Is
Yes,
it where
yes.
people come in and get their health structured for them, and then also you fit them for dresses and for suits as well? I'm assuming it has some kind of boutique aspect like that.
Not really. So I
Ah,
call it a
okay.
wellness boutique because it's for ladies, and it's really more of just an opportunity to work one-on-one with a doctor or in a group setting with a doctor and help tailor the health plan to however, your personal health.
Mhm.
So instead of the cookie cutter, hey, you need to exercise, you need to eat better, lose some weight. It's more like, let's talk about where you are right now. What is a healthy weight for you? What can we
Mhm.
do to do that? Okay, you don't like running. Let's find an exercise that you do like, that you can stick with. You don't like eating these kind of vegetables. Let's find some that can work for you. So
Mhm.
I really believe that health and just healthcare in general should be tailored. It's not one size fits all.
Mhm.
So when I work with clients one-on-one, that's what we're working on. We're just really trying to get more structure but tailored to them. So that's why I call it a boutique.
Okay, okay, that makes sense. And I totally agree about medicine not being cookie cutter
Mhm.
in general for everyone. You have to tailor everything for people specifically,
Exactly.
especially like what I always use the example when I talk to patients is the BMI. A lot of people focus on BMI. What should my weight be? Like, well, I mean, it's not that easy just to say based upon your height and your weight what your BMI should be. It's more factors that play into that. Like
Exactly.
if I did the BMI of the actor The Rock, like I'm sure he's overweight or obese just because how tall he is and his weight. Like,
Right,
but
right.
we know he's not.
Right. And speaking of BMI, I recently looked at some studies about it, and I never really thought of the fact of how it's kind of has some racial connotations to it. Like
Uh-huh.
it's not based on someone who looks like me.
Hmm.
It's completely based on like the typical European male. And
Hmm.
so you really can't just apply it head on to everybody, like you're saying. So
Right.
I think that's why, yeah, you really have to just tailor it to the person.
So what do most women come to see you for at the wellness boutique specifically? Is it just like weight loss stuff or, oh, my diabetes is not under control or my high blood pressure? What does the typical woman come to see you for?
Yeah, so in the past, what I've worked one-on-one with women is just kind of helping them lose weight.
Mhm.
Most women are, some people get to the point where they're just like, I'm not comfortable with my weight. I know I need to do something, and what I've tried in the past is not working. So I want to do something different. And right now, so I throughout the year, I'll have different programs kind of open up, like either group coaching or one-on-one sessions. And right now, I'm actually really tailoring my efforts to Black women entrepreneurs, because that's
Okay.
a whole different segment of women who need
Mhm.
assistance in really figuring out their health. You
Mhm.
as a entrepreneur myself, what I realized is that I was not doing a good job taking care of my health. I was always constantly trying to do the business stuff and build this. I need to do these landing pages, and there's always so much work, but it was hard to actually focus on taking care of my health and eating right, and especially when you add like all the other stuff. There's a family life,
I
the
don't know
kids,
about that,
all
but
of
yeah.
that.
Mhm.
Yes. So, so actually coming up soon, you all can stay
Mhm.
tuned. I'm going to be having some programs specifically tailored toward helping female entrepreneurs get better health and get the bodies they want so that they can be more confident in their bodies and more successful in their businesses. So stay tuned for that. But that's what I'm, currently working on right now.
Okay. Have you started working with the entrepreneur women yet?
So yes, I have worked
Mhm.
with a few, and it just once again kind of tailoring it towards them, whatever
Mhm.
they're willing to start working on right away. But I'm actually, I want to look at health from a different perspective. So the program that I'm coming out with now, which I think is going to be very, very impactful, is something that's helped me personally and helped, a few of the people that I've started working with, is really working on the mental aspects of it. We
Mhm.
focus so often on you have those things that the things that everybody knows about. Everybody knows you have to eat better. Everybody knows you need to exercise. But why is it that people have a hard time sticking to those things? And I think that that's where the mindset comes in.
Mhm.
So my goal with this program is really going to be to help women apply those same mindset topics that they use to build their business, Like most people know that you have to be confident about your business. You have to speak the things that you want about your business for them to happen. You know, you have to, it takes that mental work to get to the level that you want to in your business. So applying those same things to your health, learning how to speak over your health. Like the foods that I'm eating are giving my body energy and nutrition. You know, they're not going to do harm to my body. And the more that you learn to say those things and start to believe them, the more you're going to be drawn to doing them. So in essence, it's almost like teaching your mind to make your body want to do something.
Right.
You know, so all these years we've heard different things. The things that we hear are what we cause us to be drawn to certain things. And a lot of the stuff is not even intentional. You know, you may have all your life you've heard someone's, you know, something. Let's give an example of like exercise. All your life you've heard, oh, exercise is horrible. It's so hard to do. It's such a burden. I hate, you know, you hear all these negative things about it.
Girl, tell me about
it. Right. But you may not focus on you may not have heard or really focused on the positive aspects of it. What does it do to your body? How is it energizing your body? And beginning to focus on those and really understanding and believing those things will make you more drawn to it. It won't be such a pain. It'll be more of a, okay, well, let me try that. Let me try a little more. You know, once you're getting to those routines, it becomes easier. So I really want to help people learn about taking care of their health from that aspect. So that's what this new program is going to be about. I'm really excited about it.
Okay. So what kind of mental hurdles have you seen individuals have that kind of hinder them from getting that initial step going?
It's for the most part, people think it's too hard. They start off just saying, I can't do this. And I don't blame them, because if you've tried 10 different diets, you hired the trainer for a while and that didn't work. You tried the exercise program by yourself, that didn't work. After all these failures, in your mind, something starts to tell you, this is just too hard. I can't do this. But it's not true. And what people don't realize is that as long as you're doing the right things, even if you're just doing a little bit every single day, you're making progress. I've been reading this book about how the smallest little changes are what eventually have this big effect. And it's not that it's just most people quit too soon instead of sticking it out and just riding that wave and keep going. So, you know, an example I use is that, let's say diet. If you're drinking 3 sodas a day, just cutting back to 1 soda a day. So you're cutting out those other 2 over that long period of time. Let's say in a week, you've already cut back 14 sodas, you know, in a month, you've cut back 6, you know, so that little thing, it's going to add up. And people might say, well, if I cut back on 2 sodas, I'm not going to lose 10 pounds today. No, you're not, but you might in a year.
Right.
You might in a year and a half if you keep that up. So I really just want to impress on people about doing these small little things that may seem insignificant, but keeping them up and doing them consistently, and then you'll see those changes. So that's, you know, those are the mental hurdles people have. Usually the biggest one is, it's just too hard. I can't do this.
Right. Yeah, I totally agree. It's the little changes, especially with your diet, that you can make that can make a huge impact.
Oh, yeah.
Especially like you mentioned, those sodas, that's a whole bunch of empty calories that people can have that they may not be realizing, like, oh, it's just liquid. But you look at that sugar content, maybe ridiculously high. And if you cut that in half, you'll probably lose that 5 pounds that you've been frustrated that you can't lose, that you can do that by drinking water. And I always tell my patients, you can't eat what you don't buy. So don't buy that unhealthy stuff in the store. Nobody's forcing you to buy that stuff. Nobody's
don't bring it to the house.
No, nothing at all. Like nobody's in the store with a gun to your head saying, you better buy them donuts. You gotta get that bread. Right?
Yep, you're right.
No. I encourage them to do a little grocery stalking. Look at people who you may want to be that size or look like them and see what they have in their basket. And then look at your basket, like, okay, like, yeah, I may need to have a few more vegetables and stuff in my basket.
Exactly. You know, I was also looking at this podcast. It's a podcast, something I was listening to the other day, and it was just talking about how, you know, the majority of people are overweight. So they're saying for you to, if you want to actually be a healthy weight, you can't do what everybody else is doing. And it was just so like, it's an obvious statement, but it's so true. He's like, the environment that we live in, it naturally pushes people towards gaining weight. It just does. You look at most people are overweight. So to not be overweight, to be at a healthy weight, to actually decrease your chances of getting diabetes, heart disease, all these things, you have to be doing something different. So looking at those baskets and realizing, okay, I don't actually need this stuff. Let me put it back is a great place to start.
Mm-hmm. Yep. I tell my patients, you don't have to eat to be full. You can eat to be satisfied. I think that's a major problem with the American diet. We're always like, I'm not full yet. I think I can eat some more. Like, you don't have to be full yet all the time. The only thing that should be full is your gas tank. Now, you riding around on E all the time. That's on you, but that's a different story. But as far as your stomach, like, you don't have to be full all the time.
That's right.
And Dr. Oluchi is a obesity medicine specialist. So she's been trained in these type of things. So she definitely knows what she's talking about. What kind of things did you have to go through with your training for obesity medicine? And how long was that training?
Yeah, so after internal medicine, I was telling you, I worked in the wellness clinic for a while, and I just wanted to do more to kind of address the issue of obesity, because it is such a growing concern in our country and really around the world. So I went back and did a fellowship, but this wasn't a fellowship that I had to do in person. I was able to go to some conferences, learn some CME, get some CME, and then take an exam. But it was eye-opening. Like, this is really basic stuff that we should be teaching medical students. I mean, just the idea that the whole eat less, move more doesn't work. Like, it's not true. And but that's what society has kind of told people, and even medical training has told us, like, internal medicine training, that's what it was. If somebody came in and they were overweight, it was their fault. Like, oh, they must be lazy, they don't do anything. That is completely wrong. Being overweight is not the person's fault. It really is just environment and genetics. And yeah, there are things that also play into it that are our responsibility and things that we can change, but that's not the whole picture. So it was very eye-opening, and it was definitely worth it. And I'm glad that I did it, because now I can really look at the causes of things. Like, if you don't know the cause of something, you really can't fix it. So if someone is coming to you and they want help losing weight, but you don't know why they gained that weight, or they don't know why they gained the weight, then you're not going to get anywhere with actually addressing it. So it was a great training. I actually recommend that everybody with any kind of interest in obesity medicine just consider doing that, or at least doing some CME in it, just learning more about it.
Okay. And for those who don't know, can you kind of educate people a little bit upon like food deserts and not having healthy food options around? I think sometimes people don't know about those type of things until they really start opening their eyes and seeing what kind of options they have in whatever neighborhood that they live in.
Oh, yes. So first, let me just say, if you live in a neighborhood where you have a grocery store that's, let's say, even just accessible to you, like maybe 5-10 minutes away from you or closer, you are really blessed, because there are places in this country, not even to talk about the world, where that does not happen, where people just don't have access to fresh food, where people are literally having to go buy their fresh food from a gas station or a convenience store, which does not have the best food at all. And it seems like such a hard to understand concept if you've always been around these places that have grocery stores, but these food deserts are more common than you think. So that's why when we're seeing patients and we're just like, what do you mean your kid doesn't eat vegetables? And they're like, well, I don't have any. Like, I don't have anywhere to get them. If I have to drive an hour to go to a grocery store, and I can't do that every week or however long. I mean, it's mind blowing in this country that that's still a problem, but it definitely is. And it's something that we really need to work on changing somehow.
Definitely so. I mean, just paying attention. One time I didn't live in the best part of Atlanta for a short time period during my
You're in the hood?
A little bit. We'll say I was in there. hoodish. Yep. Right. But I fit in. I was straight. Yep.
Okay.
Yep. Had my J's on. Didn't have my grill in, but I had my J's on. I was still trying to save up for the proper grill. Don't listen to that, Mom.
Okay.
I'm just joking, Mom. I'm just joking. But I mean, I really kind of started when I was living there, paying attention to the different options that I had, especially going to the grocery store, seeing the produce wasn't as good. Also looking at the restaurant options and fast food options. Everything is fried and a lot of carbs. You don't see like a Popeyes or a Church's chicken usually in the quote unquote good neighborhoods. Like those are all in the lower income neighborhoods, unfortunately. So
That's true. And even like you said, the quality, that too is shocking. Just how do you have fruit that's already rotting? Like the
mhm.
moment they get it out the truck, like
Oh
how do you
yeah.
expect people to eat that?
I
And
went in there kind of bougie. I'm like, y'all don't have no asparagus?
they're like, what's that?
Where am I? Oh God. So black and bougie now.
Oh, right. But I mean, I just don't understand. And I guess, I don't know, but I feel like it's setting people up for obesity and for these medical conditions because
Mhm.
they just don't have the access to stuff. And like you said,
Right.
the options that they do have are the Popeyes and the other foods that are not healthy. Yeah,
Mhm.
people get them once in a while, but if that's your everyday meal,
Mhm.
you're not doing your body any good.
Mhm.
So
Right.
yeah, that's just another problem in this country.
So besides obesity medicine, I know you do a lot about preventative medicine. So what do you do with preventative medicine helping women as well?
Yeah, I think my biggest thing with preventive medicine that was my big passion from the beginning. So
Mhm.
my biggest thing now is just really advocacy. So I love going to health fairs where we do screening for diabetes, hypertension. I love just talking about it because you'd be surprised how many people just don't realize, like November is diabetes awareness month.
Mhm.
And
Mhm.
a lot of people may not even know about that, and a large amount of people don't even know if they have pre-diabetes. So that's one
Mhm.
thing I've kind of been talking about. So that, and then getting your mammograms. And I just really want to impress on people that these things can be prevented, or if they're caught early, can be taken care of. So
Mhm.
we just have to stay on top of actually going to the doctor and getting checked and asking questions, because you
Mhm.
also would be surprised that a lot of people they'll say, I saw my doctor and I wasn't screened for diabetes. And I'm like, where they do that at? But it's happening
Mhm.
somewhere, somehow. I don't know if it's just falling through the cracks or what's going on with that particular doctor. I don't know. But after a certain age, everybody should be getting screened because it's
Right.
so common. So I just do a lot of advocacy about it, just talking about it. I want people to hear about it from someone who looks like them, who understands, who has chronic conditions running through her family too, who's
Mhm.
determined not to get them and not to allow anybody else in her family to get them, and wants the same for, everybody out there.
Right. Right. So y'all got to make sure that you find a good primary care physician and make sure that you get your yearly exams done. I think a major problem is sometimes we don't go to the doctor unless something starts to hurt or we start developing symptoms. And it may be too late or it may be early, but you've already started to develop stuff. So you got to at least get checked at least once a year.
That's it exactly, Randy. A lot of people put it off because I feel fine. I don't have anything. But a lot of these things they're asymptomatic. You won't have symptoms until something bad happens. But don't wait for that moment. Don't wait for that to happen. You have to be proactive about it. So you're right. Going to see your doctor every year and then actually doing what they say. People go see their doctor. The doctor say, here's your prescription to go get your mammogram, and they just
Mhm.
won't go get it for whatever
Mhm.
reason. But go get your screening test done. Follow your doctor's instructions.
Right, right. And actually know your medical history too as best you can.
Yes.
Unfortunately, all the health systems don't cross over to each other. So when y'all tell me, oh, it's in my chart. I don't know if which chart you talking about.
Right.
One from 84 when you were like 3. Like I don't that was paper. They didn't put that.
Right. You definitely don't.
Yeah, they didn't scan that into your chart. Like everything doesn't cross over. You have to help us out. I'll be in this with my patient. Help me, help you.
Yeah.
I literally tell them that. And I'm just like, Lord Jesus, help me, help me, help me. So with your wellness boutique, you also incorporate faith into it also. So how does your faith practice also incorporate into the boutique as well?
Exactly. So my first book was called Worship and Wellness.
Mhm.
And it was just really focused on how, as I'm a Christian, and as a Christian, I
Amen.
believe, hmm?
Amen.
Amen. Amen. As a Christian, I believe that God has called us to take care of our bodies, not only for ourselves, but really as a way to honor Him. Because you think about it, He's given us this, and you get one body. So you really should be taking care of it and doing what you can. And a lot of people I find in faith, they feel like applying their faith, I think, in the wrong way. Like they'll say, oh, somebody mentioned I have diabetes, but I don't claim that. So I'm not going to do anything about it. I'm not taking no medicine. I'm not exercising. I'm not losing weight because I don't claim it. I don't got it.
Mhm.
But that's wrong. That's not what God told you to do at all. So I'm like, God gave you that doctor who gave the doctor the wisdom to,
Mhm.
find the problem, share it with you so that you can do things to stay healthy and take care of the body that He gave you. So
Mhm.
the book and then the program is really just about encouraging women of faith to take ownership of their health and really just start taking care of their bodies as a way to honor God. And I've been blessed with the opportunity to speak at various churches and other women's group events, and just really to share my passion for that, because I think that the church is an area that we are also not doing a good job talking about preventive health, because there's so much of this, God got me, I don't have to do anything. And I'm like, no, that's not what God is saying.
My
So,
Jesus would not give me gout. Not my Jesus.
not
Mm-mm.
my Jesus. Yeah,
He's a healer. He gonna heal me from this. I rebuke you, gout. I
that,
rebuke you,
yes.
diabetes.
Hmm.
Mhm.
Exactly. And I'm like, you can rebuke it, but I'm gonna need you to take this metformin too. Yeah.
Mhm. Right. So, so how has it been trying to like, how can I put this? To encourage people to take their medicine in those type of situations and not just depend on God to solve all their problems, and showing like the benefit of taking medicine, but also incorporating, of course, diet and exercise things into their life.
So I think really when you break it down to them and you just talk about how God gives physicians wisdom and that
Mhm.
God has, placed them there. And we talk about different scriptures that really just encourage, like, God wants you to be in good health, and faith without works is dead. The Bible
Mm.
talks about that. So you can have faith that you've been healed from diabetes or whatever it is, and God definitely has the ability to heal you. But what I always point out is that you don't get to decide how God is going to heal you.
Mm.
God can choose to heal you by that surgery that you're like, I'm never going to need, or by the medication that your doctor has been trying to tell you to take. So you don't get to decide that. And there's an analogy that I use in the book about somebody who was drowning, and God sent a boat to come get them. God sent, various different things, but they were looking for a particular way to be saved.
Mhm.
So, when they died and got to heaven, they're like, God, why didn't you save me? And God's like, I sent you so many different vehicles to help save you, and you turn them down. So you don't get to choose how God is going to heal you or take care of your body or take care of the problem.
Mm.
What you need to do is continue praying about it, but also trusting that God is going to bring you to the right people, the doctors, that can help you get to your best health. So
Okay.
that's what I usually tell people.
Okay, that's a word right there. You almost made me catch the spirit over here. Ooh, yes. Get my Joel Osteen on. Do you receive it today? This is my Bible. It is? Okay, let me not get on my
Oh
Joel.
my goodness.
But so just to go back, I know you kind of talked about Black women health. Do you feel like the medical community has done a disservice to Black women's health overall?
Oh, definitely. And that's why I'm so focused on this population.
Mhm.
I'm like, I can't be taking care of everybody, and then the people who look like me are suffering the most. I'm like, okay, Dr. Randy, think of it like this. Black girl magic is everywhere. I mean, Black women have, was it the highest or one of the highest rates of college degrees and advanced degrees. We are about to be the vice president. Like Black women achievement, even business. I think they have the highest group of new small businesses. So Black women do very well in most areas except our health. And why is that? I just feel like nobody's doing anything about that, or we're not doing enough about it. We have to make some serious changes. And I know that a lot of it has to do with the kind of the mistrust of the medical field in general. There's this, they haven't really treated us well in the past, which is true. And I get it. But at some point we have to still take ownership of our health and actually do something about it. And then from the other side, the doctors, we need to start reaching out to the population and hearing from their perspective. I gave an example about how somebody, there was a patient who didn't take her medication, and the doctor, instead of even asking, why aren't you taking it? He's just like, non-compliant. It wrote out, through her chart. And the next doctor is going to see that and be like, oh, she's just one of those people who doesn't. And you don't know you don't know why. People don't ask why anymore. Maybe she couldn't afford it. You didn't tell her about, the Walmart $4 list, or maybe she had a bad reaction to it, and she could be on something else. Maybe someone in her family took it and died from, taking that medication, and she's just worried about that. So there's all these other issues. And I just feel like healthcare in general is not taking the time to really figure that out and help women. And that's kind of why I stepped away from traditional medicine. I was just like, let me try and do this from the other side, one-on-one, and really kind of walking people through this. Because as physicians in general, we have not done a good job. I mean, why is it that the Black mortality, the postpartum
mortality,
mortality is it's terrible. It's like worse than some of these developing countries. Why is it that Black women have such a high risk of death when they're pregnant? Like, that stuff is actually very scary and doesn't make any sense.
Right.
So,
do you have any thoughts on why that rate is higher compared to other people?
So I think that part of it is that, so a lot of it has to do with preeclampsia. So that's one of the major complications that Black women are or really women in general, but especially Black women are dealing with. So there's a lot of this, not enough screening for it. Like, I'm amazed at the people who don't get their blood pressure checked when they go for prenatal visits. Like, how is that happening? Or the blood pressure would be a little high and the doctor would be like, oh, you're fine. And it's like, no, she's actually not fine. She's 8 months pregnant, and this is not an acceptable, like, she needs to be hospitalized, and somebody needs to watch that blood pressure and actually do something about it. So there's a lot of issues that are probably genetic. So Black people, some of us have the gene that makes us more susceptible to higher blood pressure. Yeah. So there's that part, but then there's also like, is the physician listening, and then is the Black person, the woman, able to communicate and actually tell the doctor her concerns about it, and be heard. So I think there's just so many layers to it. I told this story in one of my videos that, like, the only time I've been hospitalized was for the delivery of my children. And even while I was there, I was just like, look, I'm telling my husband, you can't leave me here by myself. I'm not playing these games. Like, I love my OBs that I had, but I don't trust, not that I don't trust, but I know the statistics and I know my risk, and I'm not taking any chances. I need you to be here, because if God forbid something goes wrong, I need an advocate. And that's the other thing. Maybe a lot of these women don't have somebody who will advocate for them and really get somebody's attention. When I was having more pain, like, my husband was right there, like, look, I need y'all to do something. Like, her pain is not real. She doesn't like pain medicine. She doesn't complain about it. So this is real. We need to do something about this. Right. So having someone there. So I just think there's so many layers to it, Randy. Like, and I don't know how we're going to fix it, but we have to start making changes. Like, we can't just accept it and kind of roll with it. We have to do something about it.
Right. Totally agree. So has there been any time now as a physician that you felt like something has fallen in between the cracks for you personally, like when you went into the hospital to deliver your children, or just with your, and like just regular healthcare in general? Because I don't know how you do as far as when you go in, do you let people know like, hey, I'm a doctor, I'm gonna be watching y'all? Or is it one of those things like, let me see how y'all do first, and then I'm gonna let y'all know who I am?
Listen, I don't tell people I'm a doctor
Mhm.
unless you see me in a clinic or really, I guess social media too. But
Mhm.
I try to be real low key. But unfortunately, on those sheets, they usually ask you what you do. So I usually put healthcare professional, and some people guess, some people not. But in general, like I don't think I've allowed things to fall through the crack because I'm usually very much on top of it. But I've been blessed in that sense, you know, like
Mhm.
I have the knowledge. I know that I need to, because diabetes runs in my family, I need to be screened for it. I know that high blood pressure is there too, and you know, something I need to watch out for. Like I know these things, and I don't I don't think it's fair because a lot of people don't know them, so they don't have that advantage. So it's easier for them to fall through the cracks.
Mhm.
And yeah, so I just I think I'm very blessed in that sense, but it's not the same for everybody.
Right, right. True, true. And I also agree with Dr. Oluchi. You got to be open and honest with your physician as well, letting them know certain scenarios. It may be hard for you to express those things or may be embarrassing, but you have to let us know. That's the only way that we can help you more than what we are able to help you. If you come in and don't tell me that you couldn't afford the medicine, I'm just going to think that you just didn't take it. I'm doing better a whole lot myself by asking these why questions, but sometimes it takes a lot of prying out of an individual to let me know these things. It's hard saying that I have money problems and that's why I can't get the medication, or oh, it may be some kind of side effect that you had of the medication that you didn't like, and that's why you didn't tell me. So we as physicians, of course, have to do better as far as asking certain questions.
Mhm. And I also think, you know, to your point, finding a doctor that you trust
Hmm.
has to be that has to be the basic requirement. If you go see your doctor and you can't get on the same level, the same, um, you can't get along with them, you don't feel like they're understanding you, you need to find a new doctor. Like your health is too important to just deal with it. Something is going to get lost or fall through the cracks, or you're not going to be able to express what's going on or talk about the real issues, not the I just didn't take it, like you said. Why didn't you take it? You're not going to be able to talk about that if you don't like the person or you don't get along with them. So find someone that you can trust.
Right, right. Do you have any suggestions on how to find a great doctor?
I think word of mouth is best.
Hmm.
Just ask your friends, who do they go see?
Yeah.
That's how I found my dentist. That's how I find, you know, most of my doctors really. You know, I just ask around. You do have somebody that you really like, let me go check them out.
Yep, yep. Good suggestions. And I know, like, especially for our health system, you can look us up. You can see our reviews that we have on there. After a patient sees me, they'll get a survey. They'll put the things that they did like, the things they didn't like. If they did like my dry humor, or if they didn't, they'll put that on there. And then it'll show up on our website, the type of ratings that we get overall.
But I don't trust those reviews though, because all it takes is, you know, a couple patients that didn't get exactly what you want. And
Hmm.
that's the thing, like you can't come in there telling your doctor, like, I want XYZ. If that doesn't fit your situation and it's not the best for you, your doctor's not going to give it to you. So you can't get mad and take that out on the survey. But that's a whole different discussion.
Yep, yep, that is true. They will take it out. They'll give you a 0,
Yeah.
and that'll bring your 100 average or your 5-star average down to a 3-star average because that person
Right.
gave you a
Real quick.
0. Yep, yep. And then I'm at home crying, eating creamy peanut butter out the can, just shedding tears, being all sad.
Uh,
I mean, what do you think as far as physicians? Where can the training improve into improving these biases? Does it need to start in medical school, residency? Does it need to be part of continuing medical education as we continue on in our physician lives? What do you think? All of the above?
Listen, all of the above. That's exactly what I was going to say. But it has to start in medical school. I
Mm-hmm.
mean, I was just astonished by the stuff that people don't know, and it just has to do with if you don't grow up around it, you have no idea. I mean, Randy, I went to medical school in Texas. So you would think, and most of the people are from Texas. I'm like, this is pretty diverse. Houston is very diverse. But people just didn't know stuff. Like people over here trying to prescribe medicines to treat ashiness. I'm like, that's not a rash. That poor patient just needs some lotion.
Oh man, I tell my patients that all the time. On physicals, I literally check them from head to toe. And when they take off them socks, I'll be like, woo, you gotta put some lotion on these jokers, man. I thought I was a white person when I looked at it.
Yes, but it's like things that are like that basic. But I understand if you've never seen it. But then also, so that's kind of like one of the pointless ones. It doesn't really matter so much. But the biases, things that have just you've always in your mind thought, oh, let's for example, there's this thought that Black people are lazy. So if you've always heard that, let's say since you were 4 years old, if you just continually hear that over and over and over, now you get to medical school and you're treating patients, and in the back of your mind, you're just like, I don't know. I don't trust this patient. I just feel like they just don't want to work, or let's say they're asking for an excuse because they're in some severe pain or work excuse or something. In the back of your mind, you're just like, nah, I'm pretty sure though. And in your mind, you may not even say like, it's because they're lazy, but you're more drawn to that thought just because that's what was planted in your mind 20 years ago. So it's little things like that. I talk about how there was this thought that Black people don't feel pain the same way white people do. And I was just amazed. They did a study in 2016 and people were talking about how medical students and residents actually thought that was true. Randy, in this day and age, they thought it was true. Like, are we not all human? Like, how does that make sense? But that's just
I think Blacks are superhuman. They can take all the things.
I guess that's just been the thought. And not only was it just a thought, but the people actually practiced that way. They were so much less likely to give pain medication to adequately treat a Black person's pain compared to a white person. You see just the blatant example, you see like a white woman crying about something and people are just more drawn like, oh my goodness, ease her pain, versus let's say a Black man who can be complaining about the same thing. Let's say they both twist their ankle and they're complaining about pain. Most people are going to feel like the white woman has to be in worse pain. And why? It's just because that's what society has conditioned us to think. The Black man could be suffering over there, but you're thinking, oh, he's a macho man. He'll be okay. No, treat his pain.
Yep.
So I think it has to start in medical school and then continue through on, because if you've been hearing about this and thinking like this way since you were a child, it's deep in there. It's one little lecture is not going to do anything. We had I think we did 1 or 2 lectures in medical school. I don't even remember them. It's not enough. This has to be drilled in that these biases are there. Because once you're made aware of them, then the next time that comes up, you're like, oh, wow, my first instinct was to go to treat this woman over here versus the man. And because now you see it, it's not implicit anymore. It's there, it's in your face. So I think we just have to do a better job of like putting it in people's faces so that they know that they have the bias and they can actually, if they're willing to change, take an action towards changing.
Yep. It's a consistent process. Like you mentioned, like we said, all of the above.
Yes.
Medical school, residency, as we graduate, you may pick up different biases as you progress along the way. You may not know until somebody points them out. You also need to kind of listen to people outside of your circle to hear different opinions.
Yes, exactly.
Especially recently in the LGBTQI.
Yes.
That's a whole different thing that's come around recently. Well, it's always been around, of course, but more people are starting to pay attention and be more aware to the things that they say out their mouth.
Right.
Yeah.
And just their experiences and how they feel that maybe the medical society has kind of turned from them or not accepted them or not helped them. The goal is really just to help people in whatever way we can. But if you can't relate to someone, if you can't, you can just show empathy. You don't necessarily have to have gone through what they've gone through, but just seeing where they are and being able to say, wow, I see what you're going through. I hear you. You know,
Mhm.
that's the very basic thing. But yeah, definitely that's another community that's, you know, been marginalized for a long time.
Right, right. So I'll be doing a podcast episode on that community later on next year. I already have the interview lined up to go.
Nice.
So as we wrap up, is there any kind of health tips you want to provide to individuals, especially women, to promote good health overall?
Yeah, you know, I think that you know, I really want to just put out there that getting healthy, getting to your healthy weight, all that, it's simple. As in, it's a simple process, but it's not easy. So there's a lot of, you know, there's just a few things that if you did them very consistently, you would improve your health and you would improve your weight. But just
Mhm.
doing them and being able to keep up and trying to, I guess, be consistent with them, that's the hard part. But you can do it. So some of the tips that I would like to share with you is that, you know, one of the ways to, especially going into this new year, a way that you can really take control of your health is making your health a priority. And that means actually scheduling time for you and to take care of the things that you need to do. That means seeing your doctor. That
Mhm.
means getting whatever screening exams that you need, and just deciding that, hey, you know, last year I took care of everybody else. This
Mhm.
year I'm making sure I take care of my health and making sure I know what I'm doing and take ownership of it. And that also includes things like making sure you're paying attention to what you're eating. So I always tell
Mhm.
people, you have to record what you're eating. And, you know, they have apps that help you with that, but you have to know what you're eating. You can't tell me you're trying to lose weight and you have no idea how many calories you took in
Yeah.
yesterday.
Yep, yep.
So yeah, you got to know.
Mhm.
Also, you have to move more. You know, I always tell people that exercise is so important, but even outside of exercise, just getting up. You know, our society, we spend so many hours sitting down. There was a study that talked about how something like we lose like something like over 2,000 calories a day just from sitting. And then it also talked about how when you so if you go exercise in the morning, let's say you do like an hour run or something like that, the time that you sit down throughout the day starts to cancel that out, all the metabolic benefits that you got from that run. So
Mhm.
being really intentional about standing up more, moving around, just walking around. If you have a desk job, getting up at least once an hour and taking a little walk so that you
Mhm.
get a break. So being
Right.
intentional about moving.
That's what
Yeah.
I'm worried about, individuals working from home now because of COVID.
Yes.
That's what I tell
Mhm.
my patients, that I'm concerned about you working from home because the little steps that you would do previously, just going to the bathroom, going to talk to a coworker, in and out your car, going walk for your lunch break, you basically just cut them in half, or
Yeah.
like three-fourths pretty much, and you're not burning as much, and then you're sitting at home not eating as healthy on top of it.
Exactly. Listen, the COVID 20 or whatever they're calling it, the
Hmm.
amount of pounds people are gaining, it's real. And it
Hmm.
has a lot to do with what we're eating while we're at home and then not moving around as much at home. And you're right. If the only exercise you're getting is from your couch to the kitchen and back,
To get that
that's a
snack.
problem. Yeah, to get that snack, it's a problem.
Hmm.
So being intentional, you know, start like I used to kind of laugh about people that not laugh at them, but the concept of just having a standing desk,
Hmm.
it makes a lot of sense. It really does. And you know,
Hmm.
you're burning calories doing just what you're normally doing rather than just sitting down. So yeah, being intentional about moving around more and then also getting more sleep. We don't
Hmm.
sleep enough. And sleep is you know, when your body gets a chance to rest, your cells rest, your cells go through different cycles during your sleep. It can affect weight gain. Like, you know, if you don't sleep enough, you wake up hungry because your hunger hormone, which is called ghrelin, goes way high when you don't sleep enough. So when you wake up and you're just craving things that are not necessarily good for you. So
Hmm.
sleep is another thing that's kind of been, a lot of people are not talking enough about it in our society. So those are really the main things that I would say everybody should really focus on, especially going into this new year. You know, 2020 has been just one of those years that most of us would like to forget about, but we can make 2021 a better year, especially for your health. And you can make that decision now so that you could start doing things, and that by the time you get into 2021, it'll be a routine. You'll be ready to just continue doing them. So
Right. You can start now. Nobody's saying that you have to wait till January 1.
do not wait.
That's gonna be my New Year's resolution. The way 2020 going, like we don't know if we're gonna make it to 2021. Like
For
we
real.
need to get it started right now. Okay. So Dr. Oluchi provided some great tips. I'm sure that you will listen to them. What's the name of your book once again?
Worship and Wellness.
Okay, Worship and Wellness. So y'all make sure to go get that on Amazon. We're going to bring Dr. Oluchi back for Randy's random questions. She's so excited and ready to go for the. We're going to put her on the hot seat. All right. So we have Dr. Oluchi back for Randy's random question. Everybody's favorite part, especially my guests. They're always nervous about this one. So, question number 1. If you weren't a doctor, what job would you want to have?
Oh, that's easy. If I wasn't a doctor, I would be in public health. I would be either, like an epidemiologist or someone studying these preventable diseases and especially health disparities. So I'd probably have my PhD in that because that's my passion.
Something outside of medicine if you weren't a doctor.
Okay.
You want to be.
That is a little challenging.
There we go.
Even when you spend your whole life doing like, what else do I like?
Yeah.
But, I really like photography. And I think that if I wasn't a physician, I would have put all my effort into becoming a great photographer instead of kind of okay when I am now. And I think I would have really enjoyed that.
Okay. Why do you love photography so much?
I love photography because I like capturing moments. I love looking back at, especially like pictures of my kids when they were really young and just seeing those moments because, man, life goes by so fast and you don't get those moments back. But I think photography and even videography is just a way of like cheating. You get to keep that, and when you watch it or when you look at it, you still get those same emotions. I don't know. There's just something beautiful about capturing moments. Okay.
So next question. How does one make good jollof rice?
This needs to be a whole video itself. It is a process. But I have probably the best recipe out there. And people don't want to fight me, but Nigerian jollof rice is the best. And you have to blend your tomato, onions, garlic, and then fry that, add some tomato paste, get the right rice, and then magic happens.
Where'd you get your recipe from? Is from your mom, or you in the kitchen was experimenting on your own?
No, definitely not. I obviously watched my mom all these years and then took some stuff from her and then just got a couple other recipes and really just kind of made it my own. So it might be a little bit original, but it's definitely taken from other people's.
Okay. Do you have a specific pot that you make sure you make it in? Like, this is the jollof rice pot. Like, you can't go in any other pots. It's going to taste different.
No, not that it has to go in a specific pot, but I do usually make a large amount at a time because my family loves it. So it's always in the biggest pot.
Okay. How would you describe Black girl magic?
Oh man, Black girl magic is everywhere and it's real. Black women are always succeeding. We're always at the top. You look at academics, you look at businesses, you look at sports. Black women are just so successful. And it's like the drive that we have is unmatched. I mean, the guys are good too and all that, but Black girl magic comes from Black women really just putting in that extra effort to get to the top, to be the best. And the reason I say all this extra effort is because as a community, Black women aren't given the same kind of opportunities. So we literally have to be better than everybody else to get to those same, to get in. And then after that, to get to the top. So I look at like, my medical school, where Black people in general made up 2% of the population. So in my medical school class of 240, there were 12 of us. I mean,
y'all had a surplus according to
I
my
know it.
class.
Look,
My
exactly.
class
That's
was
a
not.
lot. A lot of people are looking like,
Yeah.
wow.
Like, man,
But
y'all were double digits.
you're right. But there were 240 people in my class, Randy. I mean, that was a big class. So, and you know, it's like that in everywhere. I mean, like our VP is about to be a brown-skinned lady. That's incredible. So micromagic is not about putting down any other race. I mean, look, my white sisters, I love them. They're great too. But Black girls are killing it, and I am here for that.
And you are one of those Black women who are killing it.
Thank you.
So do you know one specific magical Black girl power that you have specifically for you that you're like, this is my Black girl power right here?
Black girl power? I don't know if it's a power, but I just relate well with people. You know, when I sit down and talk with people, they're able to, I guess, understand where I'm coming from, and I'm able to really listen and figure out where they're coming from. And so we can meet and then decide where we need to go together. So I think that, I'll say, especially in like practice, my patients will always tell me like they enjoy their appointments with me, and that they look forward to them, and that they want to come and share with me and talk to me about all their wins. You know, I'm good at really just inspiring people, because I know that people can do so much better, especially in health. So I like to push that energy on them, like, girl, go get it, do that. You know, and so I think that's one of my Black girl magic superpowers, I guess.
Yeah, I totally agree. I feel like you're very relatable, and I hope people go to your website and sign up for your wellness programs, and they'll be able to relate to you there. So I'm gonna put you on the spot here. So you have 3 children. What are their names?
Hannah is my oldest, Victoria is the middle child, and Joshua is my baby.
Okay, so like you mentioned earlier, this is all about capturing moments in time. And so in the future, we hope they'll come back and look at this video or listen to this podcast. So if you had to use one word to describe each one, what would you use? So if they come back in the future and they listen to this video, you may say, oh, Hannah's bossy. And then they could be like, see, even mama said you was bossy when you was little. So what word would you describe for each one of them?
That's a hard question. So I would say Hannah, my oldest, is sassy, but in a good way. Like she be reading people. Like, I don't know where you got that from, because I don't do that. But
how old is she reading people?
She's 6. She's like, you better get that fixed. What are you talking about? So she's very good with her words. She's been talking since she was like, I don't know, 6 months. Like, no, not really, but like an early talker, and like just loves to talk and express herself. She's the one that's like begging to be on all my videos and all this stuff. Like, maybe one day. So she's my sassy one. My middle child is my sneaky one. She's always up to something. You know, if there's somebody like climbing the roof, it's probably her. And I'm like, where do you get that from too? Like, I don't know. She's always up to something. And then she's always the one getting hurt too. And I'm like, why are you doing that? You're getting hurt.
Well, she's an explorer. That's what it sounds like.
She's an explorer, and she knows what she wants. She does not play. Like she's our very strong-willed, determined child. Like she's the one that I'll tell her go do something, and she's like, and I'm like, not in this household. Like that's not gonna work.
That's the one you have to have I'm the parent, you're the child conversation.
Yes, exactly. But you know, I'm actually trying to really cultivate that, because that's the kind of attitude that does well in society. Like you need people who are not going to allow other people to walk all over them. So I like it. It's just not going to work in my house. So
you have to do that PRN as needed.
Yes.
Exactly. Not
you
daily.
turn that off when you're in the house. And then my Joshua, he's 2, and he's the curious one. He just likes to sit there quietly and look and see what everybody else is doing, and then go do it. And then and I think he's just like being overshadowed by these 2 girls that talk so much. They're always in his ear, just going, and he's not getting a word in. But he's so smart and so like calculated. He's just sitting there like watching everything and learning, and you'd be surprised the stuff that he picks up, like you're not even teaching him. You just ask him a random question like, "Hey Joshua, where's the line in the book?" And he'll just turn to the page. And I'm like, you've been doing this since he was like 1. I'm like, you're only 1 year old. He's like, it's on this page, So he's just very curious and calculated, and yeah, you can just tell that he's just absorbing everything.
Okay, cool. He has a lot of smart parents in the household, which are educating him as well. And,
yes, I hope so.
and so your husband won't get left out. What word would you use to describe him?
Oh man, my husband is just incredibly hardworking. Like he's a full-time physician. He works he's an intensivist, a neurointensivist. So their hours are just ridiculous, especially with COVID and everything going on. He was on the COVID unit for a few months, but he's like, when he's on service, he'll leave the house at 5 a.m., get home at sometimes like 9 or 10 p.m. and just exhausted. And he still is so present in the house. That's so cool. He'll get home and he'll still like give the kids their baths or, clean up their stuff and just ask about their homework, do whatever he can. Like he's just always so hardworking, and it's incredible. He's a great husband, father, just all around good person. And yeah, he's wonderful.
Ah, sounds like you have a great catch over there.
I do.
Look at you. That's my man.
Yes.
All right. So this is the last question. What's your favorite Bible scripture? We're going to end on a good Christian message and going back to your faith and your wellness. I'm sure you have at least one that you can think of that you love.
Of course. So I have so many, but now that you said faith and wellness, I guess we'll go into that. So in John, it's third, I always get the actual verse mixed up, but John 1:2, and it just talks about that that God wants you to be in good health, and so sorry. So it says that your health you prosper and be in good health, just as your faith prospers. So and to me that just means that God doesn't only want you to get to heaven and know that you are, you did all the right things as a Christian, but he also wants you to prosper in your health and in life in general. So prospering in your health to me means taking care of your body and doing the things that you need to do. So that's what I would leave with everybody, that don't only prosper in your faith, but also prosper and be in good health.
Amen. Amen. We want you to take care of your temple.
Yes.
There's a viral video that I watched in the past before. This little kid would ask his friend, "What your grades look like?" And so we're going to make sure what your temple look like. Does your temple look good overall? Yep. Are you sweeping up in your temple? All of that. So we're going to let Dr. Oluchi off the hot seat now. Tell everyone where they can find you, social media, website, how to get in contact with you, all of that stuff.
Definitely. Thank you so much for having me on here. It is a pleasure to be on call with Dr. Randy. But you can find me, yes, on all social media at Dr. Oluchi MD. That's at DROLUCHIMD. I'm really active on Instagram. I'm also Facebook. So check me out there. You can also go to my website, which is www.droluchimd.com, and just to find out more about me.
All right. You can find our videos on YouTube as well. And just one quick last question. So when people sit down with you to do the wellness visits, is it usually covered by insurance, or is something they have to pay out of pocket? Do they get one session free and then start paying after that? How does that work out?
Yeah, so usually we have a strategy session, which is free. And then afterwards, if you wanted to do the wellness program, then that is out of pocket. So it's completely separate from health insurance, because this is something, that I want people to take ownership of. And actually, when you make an investment in something, then you're more likely to actually stick with it and to do it. So I always tell people, you have to, just like you make an investment in your, your work for your finances, all that, we all have to make investments in our health. And as long as there's a payoff, as long as you get the goals that you want, then it's worth it. So I always encourage people to make the investment in their health. So when those programs are open, there'll definitely be announcements on my website and on Instagram. And yeah, so you'll be able to find more information there.
All right. Thank you. We're letting you off the hot seat now. We'll see you for another episode. Hopefully in the future, I'm sure we'll get great positive feedback and we'll have you on for another episode.
Sounds good. It was a pleasure.
All right.